to what we call the NIFSU intake triage unit. It's the, we actually have a unit that does intake and triage just for nursing facility complaints. So regardless of source, those need to come to our office. The PT is going to outline some optional ways for the APS screeners to get those to our office, and we'll go through those in the PowerPoint as well. So for the APS field, as far as nursing facility complaints, there will be no screening or triage decision that needs to be done by the local office. That will all be done by NIFSU intake triage. And any nursing facility complaint allegation, whether it be facility, immediately to our office, and we will do the intake on that. So as far as what information we will be asking you to gather, we will ask you to gather limited information, including the complainant's name, the complainant's contact information, and the name of the nursing facility. It's possible that the complainant may not know the name of the nursing facility, and that's okay, but you will gather as much information from that complainant as possible related to those three areas: their name, their contact information, and the name of the nursing facility. If the complainant wishes to remain anonymous, that is also addressed in the PT. I don't think that I have it on the PowerPoint, but if they ask to be anonymous, the screener should, again, gather as much information as they can related to the concern, the facility, as possible, and ask if anyone can call that person back, even if they don't want to give their name, or that caller can call our complaint intake line. And again, that information is provided within the PT. So there's a couple primary complaint sources that you all received. You received nursing facility public complaints, and you also received nursing facility self-reports. So I'm going to go through the process for each of those. For nursing facility public complaints, we will be asking you to do one of about 3 or 4 options. That's if you're outside of the CAM process. So I'm going to go over if you're outside of the CAM process first, and then we'll have someone talk about if you're inside the CAM process. But if you're outside of the CAM process and you haven't converted to the CAM system, if you receive a nursing facility public complaint, we would ask that you send a secure email to nifcomplaints.dhsoha.state.or.us with the name of the nursing facility, the complainant's name, telephone number, and the facility name. Please do not include any confidential information, and that email would need to be sent in a secure format. We do have an optional form that you can use to collect that information and send that via email. I'm going to bring up that form in just a minute. And again, it's optional, but it goes over those areas. And again, this is for if you're outside of CAM. If you have not converted yet to CAM, this is a form that you could use to just collect the information and send it over. So a couple things related to the form. It's a fillable form, and if you hit submit there at the bottom, that will actually generate an email to our email intake box. And so that does that for you. So all you have to do is hit submit, secure it, and make sure there's no confidential information in the subject line, which there wouldn't be. But put the name of the nursing facility and then hit send.
One thing I'll mention too, if you haven't saved the document before you hit send, it's going to force you to save it first. So just go ahead and save it and then hit submit button, and it'll open up the email for you. The other thing I'll mention really quick is that we'll have this available out on the website somewhere. And if you go out there and pull it up on anything besides Internet Explorer, it's possible you may have to save it before you can fill it out. When we were testing this, we tried it in, I think, Firefox, and it didn't come up as a fillable form until you save it on your computer first. Looks like in Internet Explorer, you can actually fill it out right online and then hit submit, but just so you guys know that.
So another option to let us know if, again, if you can use the form, you can just send us a secure email with the information. Skip that slide. Go back to the order. Or you could fax that information as well. And our intake triage fax is provided on the PT itself, but the intake triage fax line is a dedicated fax, and that number is 1-888-550-6788. Now, so those are the three options if you're outside of CAM. You can use the form and send that via email. You can just send us a secure email with the three pieces of information, including the name of the complainant, their contact number, and the name of the nursing facility, or you could send it via fax. Those are the three options. If you're within CAM, there is a little bit different procedure, and we have slides on that, I think. Let's see. Thank you.
Like if you go forward a couple, you get the actual screenshots.
Oh.
There we go.
Okay, so where?
Shall I jump in?
Yeah, there is a slide on it. It looks like this. Right there. Perfect. You got this.
Okay, so as you all know, we are this is John Thompson. I'm from the APS Central Office team. As you all know, we're in the middle of implementing the new Centralized Abuse Management System, CAM. And so far we've got half the state up and running in CAM. And the other half will be completed in 2 phases by the end of the year. So half the state's in CAM and half isn't, which makes this a funny time to change how we do things, but that's okay. If you are in CAM, if you are in one of the districts that is already live in CAM, the process is going to be handled inside CAM through the quick intake process. If you've been trained and if you're in CAM, you've been through that. The quick intake process is just that, a quick and easy way to capture some very basic information and then do something with it. So from here forward, or starting Monday, when a nursing facility related call comes in to APS, and you're in CAM, you're going to want to use the quick intake form in CAM. If you skip ahead a couple, we can walk through the actual. There they are. Yeah, thank you. Use the actual screenshots here, and we won't get into too much depth, but we just want to give you an idea of how it's going to work and how quick and easy it really is. The quick intake tab in CAM has just very few required fields. So you're going to enter the date, the reporter's last name, if it's known. If it's not, you do the unknown process. The reporter's phone number, and then under what is the concern you want to report, you really just want to put NFSU. You need something in there so you can close it as a quick intake. So we're recommending not that you gather a lot of details and write the whole story in that box, but rather just that you put NFSU in there to make CAM happy that there's something in the field, and then keep on going. We do also want you to put the name of the facility, if it's known, there in that field also. So you can see on that slide down at the bottom, what's the concern that you want to report. When you're done, it's going to say NFSU, and then it's going to have the name of the facility if you know it. So then you're almost done, but not quite. Next slide. You go into the victim demographics tab, and you just need to select the NF box, the nursing facility box. Then, of course, if anything has come into you, say a facility self-report, you go through the uploading process, which if you're in CAM, you've been trained and you know how that works. You will upload, say, a scan of the self-report form to the CAM intake. And once you've done that, then you're ready to close. So you will pick the action button up top that says close as non-abuse intake, because we're not screening it, we're just passing it through. For the reason, select from the drop-down jurisdiction not covered in CAM. And under additional notes, just for good luck, you can put in there NFU also. So if you ever go back in there and say, well, wait a minute, what was this about? You'll see, oh, it was just an NFSU case and it went straight through to them. So that's a quick overview of the process in CAM. For those of you not in CAM yet, that probably didn't make much sense. For those of you in CAM, that probably did. So we'll all continue to be available to you as the process rolls out here to answer any questions and solve any problems that may pop up with this process. But that's how we're asking folks to handle these in CAM.
Thank you, John. Okay, so that goes over the reports that are received through the public, through the local APS office. And now I'd like to go over those reports or complaints that are received from the nursing facility themselves. We will be, and we have communicated to all of the nursing facilities this change that's effective Monday. And we have asked that they, effective Monday, start reporting directly to our office and no longer to the local APS office. So hopefully that will be a relief as far as workload on you all. But there are a couple things that I'd like to point out on this next slides, that if you do receive a self-report from those facilities, what we would like you to have to do, and hopefully that's just for a short time until they get the hang of using our number instead of their local APS number. So if you should receive a self-report from a nursing facility, maybe it's via phone call, what we'd first like you to do is clarify if the reporter themselves, if they're reporting on behalf of the nursing facility or if they're reporting as a public complaint. It may be a staff of the nursing facility that's actually wanting to make a complaint against the facility. So that is important to establish at first. Those two situations will be handled just a little bit differently. So if the reporter is reporting the incident on the behalf of the facility, please do not collect any information or from that facility, and ask that facility, the next slide, submit form APD 2803, and it was done this month. You don't have to recall that particular form number. Again, we've communicated to them. They will know the form that they need to complete, but they'll need to complete that form. If you could send us a secure email saying which facility it was that called you or faxed you or whatever, that would be helpful, because as we go along here, if there's facilities that continue to call their local APS office, we will work with them to get them to redirect to our office. We don't want to have you have to contend with that. And at first, there may be a few of them that report more frequently to the local APS office, but hopefully as time goes on, they'll report directly to our office. The other possibility is that nursing facilities send in quite a few self-reports via fax, is my understanding, to the local office. And if that happens, if you could send that fax via secure email to our NIF complaints email box, and send it secure with the name of the nursing facility in the subject line, then we will take it from there. Again, hopefully those are minimal. We've communicated to the NIFs to send it to our number, but they probably have you all on speed dial. Yeah, and John?
Just wanted to make clear that if you're in CAM, you don't have to do the step of emailing the form to NFSU, because you've already done that by uploading it into the intake, and closing that intake sends it to NFSU.
That's a good point. And again, like John said, we will be available always if there's questions that come up, especially, this is a brand new process for you all and for us. And so we want to make sure that you know that we are available. We have numbers on the backs of the slide and on the PT. John and I can be available. John Benson and I will be available, but I know that the APS central office will be available too. And so we want to make sure that you know that. So if on what could be a complaint from a nursing facility, if you find out that caller is actually wanting to report as a public complainant, then you would follow the process for going back to public complaints. And all of that is outlined again in the PT and the slides that we just covered. So, but up front, when you get that call from the facility, and if it's a staff member, you just want to ask, are they reporting on behalf of the facility, or are they wanting to make a public complaint? So a question had come up regarding nursing facility roses and whose responsibility that would be now. And we'd like to ask that effective Monday, that you no longer have to feel that that's your responsibility. We'll take that. and it'd probably be easier anyway because we'll be doing all of the intakes. And so if there's question about who, you know, if an event comes in, you get it over to us immediately. We'll take responsibility to get the rows out at that time. If any of the managers have questions on that as to who, please call us. But again, you know, we know we'll take that and that you won't have to worry about filling out the rows anymore for nursing facility complaints, public or self-reports. So I think the next step is the NIFSU complaint intake triage steps. And again, you know, we have a dedicated unit that is doing the intake and the triage for us with dedicated phone numbers, email boxes, and so they've been doing that for a little bit. Effective Monday, that will increase quite a bit, I'm expecting. And so we're developing policies and procedures for them to follow as well. And our complaint intake triage, it looks a little bit different than APS because it follows federal guidelines, and it's all driven by the federal process, but it's very prescriptive, and that is what will be followed when we are doing the intakes and triage decisions on these nursing facility complaints or public complaints related to a nursing facility. All of that information is done through intake, clear through the regulatory part in what we call a federal database system. The intake triage part is what's within ACTS. And again, I'm not sure exactly, what is it? Complaint tracking system. Aspen Complaint Tracking Intake System, I think is what it is.
Aspen Complaint Intake Tracking System.
Okay, the I is missing in there, but they call it ACTS. For all of those that are intake and triage through our unit, they will go, it's quite a detailed process actually, but the main point is that the nursing facility surveyor now will be responsible for the investigation, and they'll do that investigation just like they always have through the federal guidelines. And the APS investigator will no longer be responsible to have to do nursing facility complaints. And no intakes will be returned to the local office for investigation. I know at one, I don't know, maybe 2 weeks ago that was part of the discussion. That is no longer acceptable through CMS, and so that's been our directive, that we are not to send anything back to the local office for investigation. So the next slide, actually this slide doesn't relate to this particular field training, so we can go off of that slide. And we went over this already about the public complaint. This slide right here is just a little process map. We have sent it out as part of the policy transmittal. If maps help in your work, this just kind of outlines what the steps are for APS screeners and what the steps are for NIFSU intake. The one part that is missing in here, and we can update the and get that out to you all, is the CAM part. So we can update this slide. You could have one that if you're outside of CAM, this would be what the slide would look like. If you're inside CAM, you'd have a different slide if those are helpful to you. Some people find them helpful to post at their desk so that they don't forget the different steps. So we will work on that part. The next part is, and I want to, we'll allow plenty of time for questions, but these are the program contacts for the nursing facility survey unit for intake and triage for complaints. It's Sarah and Dave, and then John Benson and myself. You're free to email all of us, or one of us. It's probably best if you would, when you email John and I, we're pretty much the leads on this particular project. And John comes with a lot of experience related to survey and triage and intake. I have survey experience from way back, and so Dave and John have been very patient with me to catch me up to speed. I'm still feeling years behind, but we, we're together. We work all together, and so we want to be available to you for questions inside of CAM. Even if you email us, we will work with our people at APS and make sure that we get you the right answer. We've been trying to work together to make sure that what we communicate as far as CAM is what is correct, and then they know that they can call us too. So I didn't put John's number here. He's busy enough, but everybody knows John's email, I'm sure. So again, the PT will be coming out. It's pretty specific as far as these steps, and covers each area as far as a public intake versus a facility intake. So there's plenty of time for questions, and we are here to answer those. So if we'd like to open it up for questions.
Need to unmute anything?
Is there anyone that would like to ask a question?
Can you hear
I have
us?
a question.
Sure.
I have a question from Clackamas County, and I apologize. I keep getting cut off. So if you went over this already, what about community investigations for people who are in nursing facilities? Will APS still be doing those?
Yeah, that's a really good question. We had that question come in just the other day, and yes, APS will be doing those. We at Intake and Triage, we are partnering more with APS to learn more about what a community investigation is. We had training from Otis and APS related to a couple different abuse type scenarios that probably could have been community or facility, and so our surveyors are getting introduced to that through training, and our trainers are catching up, getting up to speed through the help of Otis and APS to learn more about what a community investigation is. And then we would, through Intake and Triage, refer that specific allegation over to APS. We would still do the facility part, but we would be asking APS to do the community part. Does that help answer your question?
So essentially, most of the time, the more frequent ones are regarding financial exploitation. Like, for example, someone's been living in a nursing facility, they have a power of attorney who's not paying the bill or hasn't given them their PIF money for the last year, or those sorts of things. We would not screen that then. We would send that over to NFSU, and then they would send it back to us, or we would just take it at that point. Because there's no facility, there's no concerns about the facility. It all has to do with somebody outside of the facility.
You would still go ahead and send that over. And through our federal process, we have to ensure that the facility did all safeguards related to protecting that resident and the financial part. even though on the surface it may look like it's just community, the facility, per federal regulations, they have a lot of things that they are required to do to protect that resident related to both health and financial. So we would ask that you send that over. We'll take a look at it, and then we would send that back as a community referral. And any other agencies that we would need to refer to, we would refer to at that time, but that would be considered a referral on our triage or intake process back to APS to do your part.
And will the referrals come back to APS via CAM? Via the CAM system?
I'm not sure that we're able to answer that quite yet. I don't think that they will come back via CAM because we aren't doing anything data entry-wise via CAM. We will accept information through CAM, and our intake triage people know how to do that. But as far as entering information in, that won't be our method. Our method is the federal data system. But we will get you as much information as possible. It will just look different than CAM. And if that didn't answer all of those things, as they come up, you know, or if you have other additional questions on that, feel free to send us an email. Did someone else have a question?
Becky,
Uh-huh.
have you addressed how they'll handle citizens who may walk into the office with a NIF concern or people who wish to remain anonymous?
We talked a little bit about the person that wishes to remain anonymous, and that's addressed, we think, fairly well within the PT. If the person were to walk into an office and want to report a complaint, there's a few options that the APS office could give them. They could give them our phone number, our intake phone number. They could give them our intake email address. They could ask if they were to give their number, if one of our intake people could call them back. And that's if the person wants to give all their information. The other option is they could do a quick intake just with those bits of information of the complainant name, the complainant phone number, and the nursing facility, and send that information either through CAM or through the other ways that we've talked about. If that person wanted to remain anonymous, again, it would be important to try and get as much information protecting the anonymity of the person as possible and getting that to us, and encouraging that person to call in to our 1-800 number and assuring them that we would also protect their anonymity.
Thank you.
Uh-huh. The other option, you know, I mean, I'm sure that there's several different scenarios, Allison, for your, and you bring up a really good, we tried to think of some things that, different ways that a public complainant might report, but you could, the APS screener could just give them this nursing facility complaint referral form and ask them to fill it out, and then they could keep their name blank. and either the local office could send it over for them, or they'd have the information there to send it.
Great.
But we do understand, that some people want to remain anonymous, and we will definitely protect that when they call in. Are there other questions that people can think of?
There's several questions in the comment section alongside your PowerPoint.
David's looking right now. That people have typed in?
Yeah, they've been typing in.
That's interesting.
Gosh, we apologize for that. If there are questions, we are going to try and find them. I did know that capability was through webinar, but I didn't know that it was through Skype. But we will definitely try and find that.
Oh, hold on. I think I might have. I don't know if we're going to be able to pull it up. Yeah, it's not going to let us pull them up there.
Yeah, is anyone, can all of the callers see those questions that have come up?
Yes.
Yeah, we can all see it.
Would anyone mind just taking a question and reading it to us? And we'll try
I can scroll through them and get to the questions. So I could do that real quick for you.
Yeah, if you don't mind.
And some of them were about being able to hear, I think, before we got started. So
Okay.
So one of them is, do we need to send secure email even if we send it from a state email account?
If it's from a state email account, it is secure. If it's from a AAA, it needs to be secured.
Next question is, will the PowerPoint be available after the training?
It will be, but it will be a version that doesn't have any duplicate information. I mean, I apologize. We of all days for my computer to run slow, I've had 3 days. I've had computer issues, and I've been on the help desk with many times. But the slides aren't exactly in order like I'd like them to be, but we can get something out to you for sure. The other thing that we're going to be doing is a webinar tomorrow, and that will be taped. And so that will be available for anyone that isn't able to join or wants to hear it again. And the slides will be part of that as well. And depending on the number of questions, we may develop a frequently asked questions too for the field to use. We just want to make it, as easy as possible to get through this transition.
Next question is, will NIFSU be providing services to the victim, like helping them through the sexual assault exam and going with the victim to get a restraining order?
And that's a good question. That question actually, I'm not sure where that question is from, but that question came up from one of the field offices just yesterday, and I addressed it in an email. And so we may include that as part of the frequently asked questions if we develop that. But that actually, again, the nursing facility surveyors take a little bit different look at the consumer and the protections of the consumer than APS does. APS has a really, really important role, and we as surveyors, former surveyors, and all of intake triage are wanting and trying to learn more about that APS and field case manager role. But for the survey itself, the survey looks at what the facility did or didn't do to meet the regulation. And so if the surveyor goes in and finds that the facility, one, has not called in a community APS or has not contacted law enforcement as necessary, those would be potential citations or violations of regulation for the nursing facility. If a nursing surveyor goes in and finds a really difficult situation where protective measures have not been put into place, they will be contacting their manager right away, and then that manager will be reaching out to the local APS office manager or partnering with Marie and John to find out what needs to happen to make sure that that person has protection. I'm sure that there's other thoughts on that, and maybe John, you can help with that. But we won't be doing the part about helping the resident get the restraining order. If those supports are needed, we'd be looking to the case manager or to APS or to both. And if our surveyors identify that as part of the survey, that that's a concern, or that comes to our attention at all, we'll absolutely be working with APS and the local office to make sure that that happens. The other resource that we have is, as part of the ROSE process, is Marcia Ellis is our safety officer, and so she also works directly with the local offices and APS. And so if a situation is warranted that is outside of the scope of the nursing facility surveyor but needs to be addressed, those are mechanisms to get that addressed.
I think that's probably the area where we least know exactly how it's going to look, but we recognize that. We also have a partner in the long-term care ombudsman who is in those facilities for the purpose of assisting residents with issues that they have. So I think we're just going to go case by case until we have a better sense of how that is going to work best.
Next question is, if complainants call for an update, who do they refer them to? Assuming that's an update on the status of the investigation.
Yeah, we probably would have to get that information to you. I'm not sure if we would have, I'm just not sure how that would work exactly.
Well, yeah, I think this is a good question we can take back and talk about, because there's going to be sort of 2 points in the process. One is when it's with survey still, and then once it's finished survey and with corrective action. So it'll depend on where it's at. So
but those are good questions, and someone jotted that down.
Yes.
Next question is, has the Ombudsman Office been informed of the change? And a question about how communication will go out to the Ombudsman volunteers.
The Ombudsman's Office has been informed of this change, and they actually are on the distribution list for the transmittal. And so if they have questions, they know who to contact, but yes, they've been informed. As far as the volunteers, that would be up to the Ombudsman's Office to get that out to their volunteers, but we have let the Ombudsman's Office know.
Next question, sort of covered this a little bit, but how will NIFSU be making referrals back to APS if the office is not in CAM, via phone, via email? Sort of.
I think
Well, so maybe I can answer that, because I think for the most part, you guys won't get anything back unless there's maybe some coordination at the local level to provide some outside services, like, or to coordinate hospital visits, law enforcement, maybe that kind of stuff. The other thing that might actually come back to you would be if it comes in and then we determine it's not really a nursing facility. It's actually a community-based care facility. So at that point, I think going back to what Becky said, it would be either a phone call to you guys, or we have information in ACTS that we can actually print out and send to you. If it's not a nursing facility, we're not going to have that, because we're not going to put the intake into Aspen if it's not actually a nursing facility. So that may be a phone call back to the APS office.
I think that would also apply to calls that get passed on to NFSU, and while the NFSU team is talking with the complainant, they reveal some information about, well, and their son is doing this, and they're, some sort of community involvement where APS would be involved. At that point, I suspect that would be captured in the ACTS information, and it could be printed and just sent back to the APS office saying, please look at this component of the complaint. We think that falls into your area.
Next question is, will NIFSU be providing information to local offices for a public disclosure file, and how will that process work? My initial thought is no, there would not be a local, unless it's something that APS has investigated, there will no longer be a local file for the complaints. Everything will be stored at, here through NIFSU. And it looks like the last question, will NIFSU be participating in local MDTs or multidisciplinary team meetings?
Well, I wish. I would like to. I guess, I can answer that. Sarah and Dave would probably be more appropriate to answer this, but I would think not quite yet, but maybe that's a possibility. But we definitely do want to learn more about how that works and more about the field. And I think that this is a great opportunity to partner more, and, because survey does have a role, but case management and APS have really important roles as well. And so, I'm not sure that we would be on the MDTs, but we definitely, if there's a place to sit in, or anybody wants to invite me, I'd like to go. I've always been interested.
I'll add too, if there is a case that you guys feel like it would be beneficial to have somebody from safety oversight, quality, or the nursing facility team there, contact us. Even if it's not a surveyor, we might be able to arrange to have a policy analyst or the corrective action coordinator attend, a focused meeting to talk about a specific case, or potentially, Marcia Ellis, if it was something that came through as a ROSE or safety concern. So, and I would say for the contact, send that to the nursing facility licensing email box, which is nf.licensing@DHSOHA, yada, 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 yada.
I have a question.
Yeah.
Can you hear me?
Yes.
So earlier someone asked a question about, us doing the community report. When we were in the CAM training, they were talking about how now we're supposed to, if there's a res-on-res incident in a facility, we're supposed to also make that a community report. If, let's say, one of the individuals involved is cognizant, then they become the perpetrator. So how is that going to be viewed? If there's a res-on-res with a cognizant person involved as the aggressor, are you guys going to do the facility part and then kick it back to us to do the community part with the aggressor as the RP?
Yeah, that's a great question. This is John from the APS team. Essentially, I think you have it right. It's the NFSU team that's going to get the complaint and assess it and look at all the different angles on it. If they see something that they think is a crime, they would report something to law enforcement. If they see something where a resident in a nursing facility, by any reasonable standards, should be held accountable for what they did, then that would be a community investigation, and they would send that piece back.
Well, that was my question. Do we keep the community part and then just send you the facility part, or do we send all of it to you and then wait for you to send the community part back? Or not you, but them.
The last part, send it all to NFSU. They're going to do all the screening, the sort of taking apart of all the different pieces of the complaint. Excuse me, I have a stutter. And then the pieces that are appropriate for APS will be sent back.
Well, and I will say, this is Kathy Orias. We are encouraging and enforcing facility self-reporting. So we could already have that report, and so we would be matching up the details you gathered with what the facility reported. Right. So it could get more complex.
Right.
Well, it's just pretty new to actually make a Vic a perp. You know, res on reses are usually, I mean, up until now, they were both victims, even if one was the aggressor.
Right.
So this is going to be kind of a new thing for everybody.
Well, it looks like we got one more question. If NIFSU screens out the resident-to-resident complaint for investigation, but APS would have screened it in for the community alert in that situation.
Say that again.
What if NIFSU screens out the resident-to-resident complaint for investigation, but APS would have screened it in for the community alert perpetrator in that situation?
Yeah. Well, I think where we're keep coming around to is that this is really a big change, to change our mindset to the feds require NFSU to receive all complaints and do the screening analysis and take appropriate steps. So we really, I think at some level, need to let that go and trust the process where screening will occur at NFSU, and anything that's appropriate or that they need followed up on, they will send back to us. Getting back to the PowerPoint, they don't want us to get too far into the weeds on what happened. All they want is, what's your name? What's your number? Someone's going to call you back, basically. So it's a big change, and I totally understand how that feels like a big shift, because it is. But in general, we're going to see how it goes, and we'll certainly solve problems that come up as they do.
I have a question about timelines. So the timeline, if they kick something back to us, starts when they kick it back, even though we may have taken it a week and a half prior to?
Yes. Once they determine it's a referral to APS, then it will come to you as a new referral starting on that day.
So what are their timelines? Are they similar to ours? A next day for a facility. Obviously, they're going to do the facility part, but we, right now, we have 5 days to respond to a community case. So I just was curious what their timelines are going to be, as far as how long they're going to take to triage that and assign it or give it back.
We will triage within 24 hours is our goal of as the intakes come in. And if it comes back to you, we will get it back to you within 24 hours. This is Sarah.
Okay.
Another question came in. What is the form number for the nursing facility complaint form? The self-report form is 2083.
2803.
2803. It's APD 2803.
But it is not published on the form server?
Correct. I can get in here really quick.
We have it on the LTC.
Close.
And it's on the NFLU website forms.
No, I'm okay.
Go into the nursing facility licensing unit website. This is probably the easiest way to find it for providers. And then you go under forms. It should be the top one on the list here. So yeah, it's right here. Didn't mean to highlight all that, but it's the very first one, the 2803. So if they don't have this bookmark, they can just do a Google search for nursing facility licensing unit, and then it'll pop up.
So that's all the time we have, and we thank you for joining us. Again, this will be on tomorrow at 10 to 11. And so if you want to join again, you're welcome to join. And again, it will be a taped webinar. So if there's staff that need to watch this, that will be made available. And if there's other questions that come in or that you think of, go ahead and email John Benson or I, and we'll get back to you as soon as we can. Thank you.